How you doing, everybody? I'm Kaz Schiller. Wanted to do a little video series on slap tears. I'm going to be having slap tear surgery in about a week on July 16th, and I wanted to do a little video log. I'm going to do it for about hopefully 2 months, maybe a little bit more, maybe less. Hopefully week by week, progressing again. This will be my second surgery in 2 years, but I want to kind of show everybody what's going to be happening as I'm having that surgery. I think it's really important for everybody to know how the things go through, and how you can prepare, how you can speed up your recovery if you want to, how you can better your recovery, things like that. I got a few notes here right off the bat. So I'm a week out. I've been cutting down just because I want to look a little bit leaner for the summer. Looking into where I'm going to be going into surgery, I'm going to be really close to 8% body fat, maybe a little bit lower when I go right into surgery. I have a lot of preparation that I've been doing throughout the last few weeks, and I'd like to relay that, like how you need to prep going into this type of thing. I'm just going to be using straight up ice packs for my surgery, but if you want to, there are ice machines out there. You can go to a lot of the wholesalers for medical supplies. You can go to Amazon and get these types of things that they strap on, and you're able to hook up to a machine, and you're able to circulate very cold, ice cold water through, and it'll really cool down your shoulder and reduce the inflammation, things like that. But I'm just going to be going with ice packs wrapped with ace bandage. I'm actually going to be going with a TENS unit as well. I'm going to be using a TENS unit on my bicep, front delt muscle, my anterior delt, maybe my rear delt as well as my trapezius, my lats, maybe even my serratus, and my triceps, just to make sure that that entire joint's continuing to heal as I'm going through. I want to continue blood flow. It's not going to be a very high-end TENS unit. I got some new pads and stuff like that, but the idea here is just to have a little bit of blood flow. It's not going to be shocking my arm and hurting it, but I just want to keep it going. The other biggest thing that I'm going to be doing also is I'm going to be using a meditation technique to sort of heal myself as I'm going through this entire process. What I'm basically going to be doing is thinking about really nice things, being like, I know it sounds stupid, but it definitely does work. And in fact, it can speed up your recovery by 100%, which is double in this case. And like, it's going to be amazing what it'll do. You think, you just think in your mind, you're like, oh, I want more blood flow to my shoulder. I want my body to attach my tendon a little bit better to my labral tissue, things like that. And in the end, you'll actually end up being, you do that a couple hours a day, and you'll actually end up being recovered a lot quicker. That's what I've seen in a lot of studies and stuff like that. I'm going to be eating pretty unprocessed. That's what I do normally. I try to eat everything raw. Obviously, I cook everything, but I mean, grass-fed beef, poultry that's been farm-raised, eggs that are farm-raised. I'm going to be eating on a maintenance diet this entire time. I don't want to bulk really, if any, just a little bulk, but I don't really want to pack on the fat. I don't really want to atrophy. So throughout the entire time, hopefully it's about a maintenance. The other thing that I'm going to be doing with my TENS unit for at least those 2 weeks is I'm going to be putting it on my entire body, chest, maybe a little bit of abs, but especially my chest, quads, legs, and lats. I really want to keep that muscle tissue going, so I'm definitely going to use that to be able to keep my body, the muscles firing as long as I'm up to it. I definitely want to try and do that this time. That's my plan going into this. I'm going to be doing about, like I said, hopefully 8 different logs, 8 weeks, hopefully maybe even as much as 12. We'll see how it goes, if I get a good response out of everything. I just want everyone to see what it's actually like to go through surgery. So, wish me luck. The next time that you see me, I'm going to be right in a sling like this. I'm hopefully going to be doing my next log the day of or after surgery. So look forward to it, and just, I hope this, helps and conveys an image of what's going to be going on. All right, take care. See you then.